Important surgical procedure of retina after retinal lasers, intravitreal or suprachoroidal injections is pars plana vitrectomy. That is PPV, that every medical student, doctor, house officer should know these basics. There are three ports, one at 2 o'clock, 10 o'clock, and one either at 7 o'clock or 5 o'clock, depends upon its right eye or the left eye. This is intraocular illumination source, other one is vitrectomy cutter, and the third one is irrigation cannula. Details are described in retinal detachment surgery and vitrectomy surgery. This video we're gonna discuss types of PPV, their indications, instruments, and vitreous substitutes or tamponading agents. Types: 20 gauge, that is 0.9 mm, usually requires suturing. 23 gauge, 25 or 27 gauge do not require sutures. Conventional PPV versus PPV in advanced complicated cases. Indication include retinal detachment surgery, vitreous hemorrhage due to any cause or traction, anterior segment surgery, nucleus drop or IOL drop for its removal. Can you appreciate the hole in the retina? Other indications include endophthalmitis, macular surgeries like surgery on macular hole or ERM removal, intraocular foreign body, complicated glaucoma with AVGs or capro or Boston prosthesis or diagnostic vitrectomy. Other than conventional instruments used during any intraocular surgery are the vitrectomy machine and vitrectomy cutter, endo laser delivery system with its illumination pipe, wide angle viewing system, endodiathermy, scissors, forceps, 3-port cannulas, grasper, flute needle, dye or vitreous substitutes. 3 ports, 2 o'clock, 10 o'clock, 5 or either 7 o'clock. Position are 4 mm from limbus in case of phakic eye and 3.5 mm behind the limbus in pseudophakic or aphakic eye. These positions are for better ergonomics as they improve fluid dynamics and easier to manipulate instruments and provide easy access and view to the retina, provide less strain on surgeon's hands, make procedure smooth and comfortable for surgeon, and ultimately lead to better outcome for the patient as well. Which instruments can be used for scleral indentation and why it's important? Vitreous substitutes are used either to replace the volume or as a tamponading agent. Main aim is to achieve intraoperative retinal flattening. Ideal substitutes are transparent, clear, non-toxic, inert, with low viscosity, immiscible with water, slowly absorbed but durable. Commonly used vitreous substitutes are intraocular gases that can be SF6, C2F6, C3F8, silicone oil, saline, heavy liquids, or even air. Every vitreous substitute has its own advantages and disadvantages. They are explained separately in separate videos like silicone oil. This is 3-port pars plana vitrectomy in vitreous hemorrhage and intraretinal bleed with ILM peeling. This is retinal laser, OSCE, and vitrectomy machine. This is dye used during macular hole surgery or during ERM removal. Details of types of vitrectomy that are anterior vitrectomy, anterior core vitrectomy, pars plana vitrectomy, conventional, simulated, or vitrectomy in advanced cases is explained in other videos. Thanks all patients for their consent and cooperation. Post-operative medication, posture and follow-up is very important.